Meet Dr. Iswanto Sucandy, a highly experienced board-certified surgeon who specializes in minimally invasive and robotic surgery for gastrointestinal disorders in Tampa, Florida. Adhesions are a common complication following abdominal or pelvic surgery, and they can lead to significant morbidity, including acute small bowel obstruction, as well as reoperations and increased healthcare costs. To reduce the incidence of adhesions, Dr. Sucandy uses SEPRAFILM adhesion barrier, a bioresorbable adhesion barrier that he has found to be effective in reducing the incidence of adhesions in his patients. SEPRAFILM adhesion barrier is a translucent, pliable film composed of hyaluronic acid and carboxymethyl cellulose. When applied to the surgical site, it forms a temporary barrier between adjacent tissues, reducing the likelihood of adhesion formation. The film resorbs within a week and is completely eliminated from the body within 28 days, reducing the risk of foreign materials left behind long-term. Dr. Sucandy has found SEPRAFILM adhesion barrier to be an invaluable tool in the prevention of post-operative adhesions following traditional open and robotic hand-assisted laparoscopy. He has applied it in a variety of general surgery cases. SEPRAFILM adhesion barrier has been designed for its ease of use with clinically proven safety and efficacy. In his experience, the incidence of adhesion-related complications has decreased in patients treated with SEPRAFILM adhesion barrier. Let's join Dr. Sucandy in a recent hybrid, robotic, hand-assisted laparoscopy case. After securing hemostasis, he is now ready to apply SEPRAFILM adhesion barrier through the open element incision. To apply SEPRAFILM adhesion barrier through the open element, Dr. Sucandy utilizes two different techniques that he will demonstrate here. In the first mode of application, the protective Tyvek paper that surrounds SEPRAFILM adhesion barrier remains in place until it is passed through the open element incision. SEPRAFILM adhesion barrier is folded lengthwise around the instrument and passed through the open element incision. The protective Tyvek paper is then removed following placement. In the second mode of application, the protective Tyvek paper is removed prior to placement. For this method, the SEPRAFILM adhesion barrier is carefully folded in thirds and passed through the open element incision. SEPRAFILM adhesion barrier then expands for tissue coverage following placement through the open element incision. SEPRAFILM adhesion barrier should be sufficiently extended beyond the margins of incision and associated surgical trauma to achieve adequate coverage. By effectively preventing adhesions, SEPRAFILM adhesion barrier can lead to improved patient outcomes. This includes reduced pain and discomfort, lower rates of bowel obstruction, and a decreased need for reoperations due to adhesion-related complications. Dr. Sucandy uses SEPRAFILM adhesion barrier in his practice because it's a simple yet effective solution that has made a real difference in the lives of his patients.
Indications for use. SEPRAFILM adhesion barrier is indicated for use in patients undergoing abdominal or pelvic laparotomy as an adjunct intended to reduce the incidence, extent, and severity of postoperative adhesions between the abdominal wall and the underlying viscera, such as omentum, small bowel, bladder, and stomach, and between the uterus and surrounding structures, such as tubes and ovaries, large bowel, and bladder. Important risk information. SEPRAFILM adhesion barrier is contraindicated in patients with a history of hypersensitivity to SEPRAFILM adhesion barrier and/or to any component of SEPRAFILM adhesion barrier. SEPRAFILM adhesion barrier is contraindicated for use wrapped directly around a fresh anastomotic suture or staple line, as such use increases the risk of anastomotic leak and related events: fistula, abscess, leak, sepsis, peritonitis. SEPRAFILM adhesion barrier must be used according to the instructions for use. SEPRAFILM adhesion barrier is for single use only, supplied sterile and must not be re-sterilized. Every opened and unused SEPRAFILM adhesion barrier pouch must be discarded. Do not use product if pouch is damaged or opened. The number of sheets used should be just adequate to cover the undersurface of the abdominal wall or uterine incision in a single layer. In patients who have ovarian primary peritoneal or fallopian tube malignancies, SEPRAFILM adhesion barrier use has been reported to have an increased risk of intra-abdominal fluid collection and/or abscess, particularly when extensive debulking surgery was required. The safety and effectiveness of SEPRAFILM adhesion barrier has not been evaluated in clinical studies for the following: patients with frank infections in the abdominopelvic cavity, patients with abdominopelvic malignancy, such as device use on resected liver surfaces following hepatectomy for malignant liver tumors, device placement in locations other than directly beneath an abdominal wall incision following laparotomy, or directly on the uterus following open myomectomy, not laparoscopic, patients with ongoing local and/or systemic inflammatory cell responses, device use in the presence of other implants, for example, surgical mesh, patients requiring reoperation within 4 weeks of SEPRAFILM adhesion barrier during anticipated time of peak adhesion formation. Foreign body reactions have occurred with SEPRAFILM adhesion barrier. The safety and effectiveness of SEPRAFILM adhesion barrier in combination with other adhesion prevention products and/or in other surgical procedures, not within the abdominopelvic cavity, have not been established in clinical studies. The safe and effective use of SEPRAFILM adhesion barrier in pregnancy and cesarean section has not been evaluated. No clinical studies have been conducted in pregnant women or women who have become pregnant within the first month after exposure to SEPRAFILM adhesion barrier. Therefore, this product is not recommended for use during pregnancy, and avoidance of conception should be considered during the first complete menstrual cycle after use of SEPRAFILM adhesion barrier. Long-term clinical outcomes, such as chronic pain and infertility, have not been determined in clinical studies.